Other questions?
If you're an Alzheimer's patient, are you under the care of your family doctor plus the psychiatrist? I mean, are they working
Good question.
together?
The question is, should you see a psychiatrist or a family doctor, or the other one's a neurologist?
Okay.
And I would say all of the above, or either one. I mean, the way I would approach the issue is sort of the comfort level of the physician involved. So there are some psychiatrists, me being one, is very comfortable with Alzheimer's disease or dementia. I just had an interest in that and did a lot of time studying it and reading about it, and still do. And so I'm very comfortable with it. Now there are some psychiatrists who, maybe they're child psychiatrists, let's say, and they just would not even know anything about it and be very uncomfortable. I think the same goes with neurologists. There's some that are very comfortable with it and some that aren't, and the same with family doctors. So if you have a family doctor who's very comfortable treating Alzheimer's disease, you could just ask them that. You could say that it's not a bad thing to ask. Family physicians should be okay with that. They know that they have expertise in some things and other things that they don't feel strong on. Now they may not want to admit it until you ask, but if you ask, they may be willing to say, well, now that you mention it, I'm not sure what to do next. Maybe the family member is having some behavioral issues. That's a lot of times when the psychiatrist comes in. Is when there's the psychosis or the depression or the agitation, the behavioral problems. That's when the psychiatrist usually comes in. So the family doctor will say, really, I'm not sure what to do with your mom. I mean, she's kind of agitated. We tried this. She had some side effects. I don't know what to do next. And then maybe they'd refer you to a psychiatrist. So that's kind of how that goes. I guess there's no right or wrong. I mean, did I answer that question?
I think so. Yeah. I just didn't know if it was just a combination. You were going to both at the same time, and you
would keep your family doctor.
Yeah.
Yeah.
But, in other words, would he be treating, or would both of you be treating Alzheimer's?
Usually,
you're going to be giving medicine for different things.
Yeah, that's a good question. What you're talking about there is who does what.
Yeah,
and really,
I could have said that.
In an ideal situation, both the physicians should communicate well enough that they would know what each one of them is doing. Sometimes that doesn't work. I can't believe that in this day and age of technology and communications that we can't, that we don't have a credit card sized little memory chip that has all our medical history on it. You plug it in, you see right away what Dr. So-and-so gave you last week, and then this doctor does, and then the next doctor can see everything. So that, unfortunately, we're not there, and the communication sometimes isn't good. So as a consumer, as a patient or a family member, the best thing to do is to communicate with that physician and make sure they realize, you remember you referred us to Dr. Smith, and he's handling this medicine, this medicine, this medicine. Make sure he knows, the family doctor knows that. And then hopefully, the family doctor won't touch that. Now, I've been in a situation before where I'm managing somebody's, psychiatric issue, whether it's dementia or whatever, and the family doctor tweaks things on their own, even though I'm doing it, that's kind of tough. I try to send a letter, I try to place a call and say, really, one of us needs to do it, but not both, because there's going to be problems, because we're not going to know what each other's doing. So that sometimes happens, and with some physicians more than others, and you just sort of have to get to know the physician and know whether that's going to happen, unfortunately, which is a better way than that. But any other questions?
What is the difference between what we used to call hardening of the arteries?
Okay.
Is that, I'm sure it's just a plaque or something, but I never heard of Alzheimer's disease, and it was always hardening of the arteries.
Yeah.
Now you never hear of hardening of the arteries anymore.
Right. You're talking about with the brain, hardening the arteries in the brain.
People, I knew people, they walk out in the middle of the night and go to the cemetery, and their minds just weren't right.
Right. They probably had Alzheimer's disease. The old days, the question was, what is hardening of the arteries, and is it related to Alzheimer's disease? In the old days, we didn't know what to call things very well, so we would call it senility, or we would call it just old age, just have an old age, which isn't, by the way. That's not what it is, Hardening of the arteries is another one. And senility may not be too far off the track. It may be what's going on, there's some kind of vascular problem, or some type of damage that's being done because the arteries are not healthy. But, it's probably, all those things probably were Alzheimer's disease, or some form of dementia. I mean, it could have been some other type of dementia as well, the vascular or some other kind, but it sounds like, the wandering is very common with Alzheimer's disease. And the agitation too, I should mention that you were talking about taking care of somebody in a nursing home with Alzheimer's disease. One of the things that I talk to when I talk to nursing home staff about that are working with, or even family members working with a patient with Alzheimer's disease, imagine for a second, you guys put yourself in the position of that person, okay? You don't have a very good memory, so you really don't know where you are right now, okay? You don't know who this person who just walked in the room and said it's bath time, you don't know who that is, okay? You're a guy, you're 95 years old, you've been independent your whole life, and this young chickie poo or whoever it is comes in, and she says it's time for your bath, right? And you're saying, I'll decide when I take my bath, And then she doesn't like that because she's got a lot of patients to see. She's under pressure to get everybody bathed, and by a certain amount of time, she starts to take the clothes off of this gentleman, and he starts to get a little offended. How would we feel? Somebody that we didn't know, we didn't know where we were. All of a sudden, some stranger comes up, starts taking my clothes off, starts trying to give me a bath. At first I'd probably, try to say something, and of course these folks, maybe they don't have very good judgment, so they may not say anything at first, they may just strike out. But eventually they're going to get agitated like we would, right? So think about it like that. I mean, the brains aren't working, so it's not their fault. They don't mean to be mean or try to hurt anybody, but they just are feeling threatened and feeling invaded, and, that's sometimes what happens. So the other thing is, when you're taking care of somebody like that, you can sort of see that coming. I mean, it's not usually just out of the blue. Sometimes it is. But you can start to see, the voice, the signs of that. The voice starts to get a little bit louder. They start to get, everybody knows how that is. You're talking with somebody and they start to get a little bit louder, and a little bit louder, and a little bit louder, and it's time to start backing off at that point. Schedule or no schedule, I don't care. It's not worth getting beat on, So get out of the room, back off and say, oh, okay, Mr. Smith, I'll come back later. And the memory is so short that the next time you come back, you approach things a whole different way. Maybe you present, things, you sit down and talk for a few minutes before you even introduce the idea of a bath, and the whole approach is different, and then the person now is comfortable with you, and everything goes fine. So you see that kind of a lot, actually. So, another piece of advice. Any other questions? Good questions, by the way. All right. Yeah?
I think it's hard to deal with a friend who has a person, their mother is having Alzheimer. She's an Alzheimer's patient, and then once in a while that mother will click in and be a little normal, so then the daughter gets, mother's getting better, is going to work. I think it's so hard to deal with that person when you know what's going on in the brain, and it's deteriorating and it's not functioning at all. And it's hard to be counsel and friend to the people who are suffering with the parent.
Yes.
And how you handle that, and you can't blatantly tell them, the daughter, because in a way they also don't understand what's going on.
So the question is how to handle, how to approach the friend who's taking care of somebody with Alzheimer's disease, and what are we approaching them about? Are we approaching them about how they approach the patient?
Because mother, every once in a while, clicks in, makes sense, and so they're thinking, okay, things are going to be better.
Oh, she's better. Yeah.
And really, in just in just a short time, then the daughter is down again. It's just an up and down thing. I see
the emotional roller coaster that occurs when
the caretaker.
Yeah, in the caretaker, when the person with Alzheimer's disease has moments of clarity.
Right.
I should have brought that up too, I apologize, but the moments of clarity thing is another really tough one on family members, just exactly like what you're saying there, because they're like, at that point they're like, oh, she remembered this. If she remembered this, then that means she's okay. She must not have Alzheimer's disease. Well, an hour later, she can't remember something else that's very easy to remember, and so it's very confusing. Why is that? I mean, first of all, when we go back to your question, how do you support the family member on that? I don't probably just kind of supportive, just being there to listen. I don't know that it's good to really challenge them and say, well, you remember though she didn't remember this, or you remember she didn't remember this, and bring all the negatives about it, because then that's just going to make the person a little bit more depressed and not want to be around you much. But if But, you know, just sort of supportive stuff. You know, I guess the best thing to do is to give the person or help give the person some time off.